Every retirement plan has a ghost in the machine. You've done the math. You've looked at your 401k, your Social Security statements, and your home equity. You've concluded that if you withdraw 4% a year, you'll be fine. But there is a variable most calculators ignore: the compounding brutality of healthcare inflation. Today, we aren't just talking about a 3% or 4% rise in prices. We are looking at a fundamental restructuring of what it costs to grow old in America. Imagine it's the year 2046. You are 20 years older than you are today. You walk into a clinic for a routine checkup, and the out-of-pocket bill for a standard procedure is more than what you used to pay for a monthly mortgage. This isn't a dystopian fantasy, it is the mathematical trajectory we are on right now. In this deep dive, we are breaking down the 3 cliffs of aging. We will explore why 2026 is the year of the shift, why the middle class is currently in a long-term care trap, and exactly what you need to do starting tomorrow morning to ensure your legacy isn't liquidated by a hospital billing department. The 2026 Medicare Cliff. Let's get granular. Why is 2026 the year we should all be watching? For decades, Medicare was the predictable part of retirement. But as we move into 2026, 2 massive forces are colliding. First, the silver tsunami of the boomer generation is hitting its peak medical usage years. Second, we are seeing the arrival of miracle science, drugs like Ozempic, Wegovy, and new Alzheimer's treatments like Leqembi. These drugs cost the system billions, and while the government is negotiating prices, the shortfall is being passed to you through Part B premiums. In 2026, we're seeing premiums that are nearly double what they were just a few years ago. But the real hidden tax is IRMA, the income-related monthly adjustment amount. Let's look at the success penalty. If you've saved well, the government sees you as a source of revenue. If your modified adjusted gross income from 2 years ago crosses a specific line even by $1, your Medicare premiums can skyrocket. You could be paying $500 or $600 a month for the exact same coverage your neighbor gets for $200. Think about that over 20 years. That's a $100,000 difference in your retirement nest egg just based on which side of an income bracket you land on. We are going to show you how to manage your income buckets to stay below those cliffs. But first, we have to talk about the hole in the system that no one wants to look at: the long-term care black hole. This is the segment that usually makes people want to turn off the video. I'm asking you to stay with me because ignoring this is the fastest way to lose everything you've worked for.
Before we continue, please consider subscribing to the Aging Without Regret channel. This channel was created just for you. Every day we publish content that helps you reflect more clearly and make smarter decisions about retirement, Social Security, Medicare, money management, and healthy aging. Through quality, consistent, and relatable content on practical retirement advice, retirement planning strategies, and real-world stories that highlight common retirement mistakes, financial risks, and aging challenges, we help you avoid retirement-related problems many people face today. If you're planning for retirement, feel behind financially, or want honest guidance on aging well, this channel is for you. Hit the subscribe button now.
Most people believe Medicare covers nursing homes. I will say this as clearly as possible: it does not. Medicare covers skilled nursing for a very short window, usually 20 to 100 days, if you are recovering from a surgery, but it does not cover custodial care. If you need help getting out of bed, showering, or eating because of age or dementia, you are on your own. Today, a private room in a quality facility averages $120,000 a year. In 20 years, with a modest 4% inflation rate, that number becomes $263,000 per year. If a couple both needs care for just 3 years each, you are looking at a $1.5 million bill. This leads to the spend down. To qualify for Medicaid, the government program that pays for long-term care, you must essentially become destitute. In most states, you cannot have more than $2,000 in countable assets. The system is designed to claw back your wealth. If you try to give your house to your children today because you think you'll need a nursing home tomorrow, the government looks back 5 years. If that transfer happened within that 60-month window, you are penalized. You are left in a no-man's land where you have no money and no government help. The 20-year tech paradox. Now, let's pivot. The future isn't just about rising costs, it's about a massive shift in how we age. We are entering the era of the tech paradox. By 2035, AI-driven diagnostics will be in your home. Your smart mirror might detect early signs of Parkinson's by analyzing your facial micro-movements. Your flooring might detect a change in your gait, the way you walk, predicting a fall weeks before it happens. This tech will be expensive to adopt, but it will save you millions in hospital stays. The paradox is this: we're getting better at keeping the body alive, but we aren't yet great at keeping the body maintenance-free. We are moving into an era of super longevity. If you are 65 today, there is a very high statistical chance you will live to 95. That is 30 years of retirement. Your 20-year plan is no longer enough. You have to plan for a 35-year arc where your biggest risk isn't the stock market crashing, it's the stock market staying flat while your medical needs increase. The Survivor Roadmap. So, how do we win? How do you become one of the retirees who thrives while others are submerged by these costs? It comes down to 3 strategic superweapons. First, the HSA shoebox strategy. If you are still in your earning years, your health savings account is more valuable than your IRA. Don't spend it now. Pay for your current doctor visits with cash. Save the receipts. Let that HSA money grow in the S&P 500 for 20 years. In 2046, you can reimburse yourself for those decades of receipts tax-free. It is a massive tax-free bucket of wealth specifically for your health care. Second, the hybrid asset pivot. Traditional long-term care insurance is dying. The premiums are too high. Look instead at hybrid life LTC policies. You put a chunk of money in, and if you need care, you have a massive pool of tax-free money. If you don't need care and you die peacefully in your sleep, your children get a death benefit. It's the only way to ensure that your money either takes care of you or takes care of your family, no matter what. Third, physical equity. This is the most authoritative advice I can give you. Your muscles are your retirement fund. Sarcopenia, the loss of muscle mass, is the leading cause of falls that land people in those $200,000 nursing homes. Investing an hour a day in strength and mobility right now is a financial decision. It is the highest ROI activity you can perform. The next 20 years will be brutal for those who are blind to these numbers, but for those who see the cliff coming and build a bridge, it will be the most dignified, peaceful era of their lives. I'm aging without regret, and this is your roadmap. I'll see you in the next deep dive.